Okay, good evening. I'm Rick Ellenball, City of Batesville Mayor, and I'd like to welcome everyone here. And I tell you what, quite a turnout. And I think most of you probably found out that it was my birthday today, and this is my birthday party. So it's not every day that you get the governor to come to your birthday, but when he called last week, he said, I think about coming to Batesville. I heard it was your birthday. I said, great, we got that worked out. So anyway, seriously, it is good to see everyone, and we probably could have had this in the gymnasium. So, but before I get started, I'd like to say thank you for what you do here in our community. I know we got a lot of business leaders. We got some folks that have come in from out of town. So glad that you're here. I have some of my city council members here, Dr. Doug Matthews, Mr. Fred Krug, Brittany Bennett, Miss Julie Hinkle, and her son Carson, and Mr. Chris Poole. And of course, I've seen my son out there, and this is the first time I think he's been to any city event. So my son Rusty, so this is after 15 years being mayor and your son shows up, this is pretty important. So that's right, it's my birthday, yeah. Hopefully he has me a gift. I don't think this gentleman here needs much of an introduction. He has led our state for the last 7 years, and he has one of the best economy that we've had in years. We've had challenges with COVID. He has been a leader. He's always doing what's best for the state of Arkansas. He continues to advance our state, and that's a good governor. And we see a lot of governors on TV, and we're going to see our governor because, congratulations, he was just appointed chair of the National Governors Association. So congratulations. Our governor from the great state of Arkansas, Governor Asa Hutchinson.
Thank you, Rick, and yes, happy birthday. And he told me today coming in that he stopped celebrating them, but I don't believe him. So this is really impressive, as the mayor said, to call on very short notice a town hall meeting, if you will, part of my community COVID conversations, and to see this kind of a crowd out here really demonstrates that you care, that you have questions, you're willing to talk about it, and to see how much better we can do here in the state of Arkansas. And so Mayor Ellenball has been a great leader for this community and a good partner with me as well. I know that we have Representative Stu Smith here, and Representative Stu Smith and Representative Craig Christensen here. Any other members of the General Assembly I missed? Thank you all for being here. You're key partners in us. I know we have a Representative Senator Bozeman here, I believe, and maybe Senator Cotton's office. But thank you all for being a part of this as well. Let me get right to it, though, because we've got a lot of people here. We want to hear from you, but I want to lay the groundwork for this conversation, and so let me talk just a little bit. Over the past month, we have seen a significant increase in the number of COVID cases, active cases, and hospitalizations. And let's just put it in perspective. On June 7th, that is not that long ago, right? June 7th. We had about 1,600 active cases. 1 month later, we had over 6,600 active cases. That's the kind of increase. If you look at on the total of new cases that we're having every day, on June 7th, we had 62 new cases. A month later, on July 9th, we had new cases of 1,155. So we go from 62 to 1,155. When in terms of hospitalizations, 1 month ago, we had 175 Arkansans that were in the hospital because of COVID. One short month later, we had 497 hospitalized because of COVID. And so that tells you what's happened in a month. Now, you could also just look at this weekend. We had more cases, but we also had 55 additional Arkansans hospitalized over this weekend. Now, I've watched this for over a year, and I know that people don't like to go to the hospital on the weekend. They usually wait till Monday, which tells me that if they go on the weekend, they're really sick and they need help. And I think about those, and you look at the statistics, and those are not people who've been vaccinated. And so we have a challenge here, and I want to talk about Independence County because this is probably one of the most interesting statistics to me. We might have it up here on the graph. We'll see if that pops up. But here in Independence County, we have fully vaccinated 29.4%. Now, put that in terms of our goal. You know, we want to get to 70%. We want to get to 50% this month of our entire population. But here in Independence County, and this is on the right, you see Independence County, 29.4%. Now, the other statistic of the 5.9, I believe that's partially vaccinated. So let's just look at the fully vaccinated, 29.4% across the county. Now let's look at Batesville because our Department of Health broke it down by city. And the city of Batesville has 69.3% vaccinated. Now give Batesville a round of applause there. Now, I did not come here to praise you, although Batesville should be praised. That's great leadership, Mayor. But it shows the challenge that we have. Where do all the people that live out in Independence County shop? They shop right here in Batesville. They come here and they go to school, they go to church here, they go to our community, and they're part of our community, and we care about them, but they have such a low vaccination rate out in the rural areas. That is the lesson. And it was not any different when I went to Cabot, and in Cabot you had high vaccination rate in the city, low vaccination rate in the rest of the county. We're going to be looking at this all across the state, but there's a lesson here, and it tells us the job that we have to do, and we have to not just get the vaccination here in Batesville, but all across our areas in the rural areas of our state. And I want to thank, by the way, the White River Health Systems because they have a vaccination clinic outside that's set up, and that's going to be helpful. Hopefully, people will take advantage of it. Now, let's go back to the increase in cases. What are the reasons for the increase in cases over the last month? First of all, there's an increase in cases because we have the new Delta variant. We did not have it going at warp speed a month ago, but now it is going faster and faster across our state, and not just in Arkansas, but the White House tells me that 50% of their new cases nationwide are coming from this new Delta variant. And so it is more contagious, it is more easily transmissible, and it can lead to hospitalization more quickly. And so that's the reason the Delta variant is significant. One of the reasons we had other cases, or increasing cases in the last month. The other reason, though, is the low rate of vaccination across the state of Arkansas. If you look at across the state, 43% of Arkansans have received at least one shot. Again, hats off to Batesville because you had much higher than that. If you look at nationally, it's 55% has received at least one shot. 43% versus 55%. If you look at fully vaccinated, Arkansans are 35% fully vaccinated, and nationwide is 48%. And so there is a gap between what's happening nationwide and what's happening in Arkansas, and that low vaccination rate is a challenge for us. And it's interesting, if you look at the states with the highest vaccination rate, Vermont, 66%. Massachusetts, 62%. Maine, 62%. Connecticut, 62%. Rhode Island, 60%. You look at the states with the lowest percentage of the population fully vaccinated, Alabama, Mississippi, Arkansas, Wyoming, and Louisiana. What do those states have in common? Most of them are southern states, all are rural states, many of them are delta states. And so we have, you know, an extra challenge here, but I look at the urgency of the matter right now. What is the urgency of the current moment that we have? And the urgency is reflected by the fact that we have school starting in a month. We have school starting in a month. How many of you are educators that are here tonight? I know we got a number of them. Thank you all for what you did. We had a great school year last year under trying circumstances, but we want to have a great school year this coming year, and we're really positioned well to do that. But if we do not increase the vaccination rate, what kind of school year are we going to have with the Delta variant that is out there? And so we have got an urgent moment in time to increase that over the next 30 days. Secondly, as I said, the Delta variant is gaining ground, and the good news is that the vaccinations are effective even against the variants. And we have Dr. Jennifer Dillahay here, who's my state epidemiologist, and she works with Dr. Jose Romero, that you probably have seen more of. But she can correct me if I'm wrong. These are statistics that are cited by CDC, but the vaccinations are effective. Remember, you hear them talk about, well, you know, we need a 70 or 80% vaccination effective rate. Well, they got it up to about a 90% effective rate for the vaccination. But what does that mean? Because I know you'll hear this. Well, I know somebody who had the vaccination, they got COVID anyway. Well, if you have a 90% effective rate, that means 1 out of 10 might get the COVID even though they've been vaccinated. But what it does, it prevents hospitalization and it prevents death. And so the effectiveness of that vaccine stops us from having the harm from that Delta variant. The other challenge, of course, is that the unvaxxed area of our state can really be an area or like a test tube where a new variant could develop. Right now we have about, 3 variants, and the variant started and developed through the course of the virus spreading. Well, the idea is that you get a handle on the virus by society being vaccinated, and it prevents the development of new variants. We don't want that to happen, and so Batesville needs to make sure that we get everybody vaccinated because we won't hopefully have the continued spread. The key is very simple, and the key is not what government does. The key is not what I can do as a governor. The key is not by any mandates or anything that comes down from anywhere. The key is simply each individual making a good decision. And also the key is the community taking the leadership. And that's why when I've done everything I can, I've had my weekly news conferences, my daily news conferences, we've got vaccines available all across this state, but we see the myths, we see the misinformation that's out there, and I thought perhaps it'll be helpful to have a community conversation. And so please ask your questions. We had incredible questions when we were over in Cabot. Now, I do ask you, as you ask questions or you make a comment, keep them fairly brief because we want to have a good discussion tonight, and then be respectful. And that is the most beautiful thing about Arkansas, is that we know how to talk and maybe even disagree, but we're respectful of each other. And so I just ask you to do that tonight, but I look forward to the conversation. And I put it out here, you know, these kind of questions I'd like for you to think about. One, what can we do to address hesitancy of the vaccine? What are the reasons people that you know are not getting the vaccine? This is helpful for us to know. Is there anything more we can do as a community to educate or to answer questions or to help the vaccines get more accessible and utilized over the next 30 days particularly? With that, I want to turn it open for questions and comments that you might have, and we're listening, taking notes, and look forward to it. I know the first one's always hesitating. We have right back here. Yes, sir.
You mentioned going back to school. Is there any special effort being made by the school districts to address the issue with the parents of these young kids that can't be vaccinated in terms of requiring them to get vaccinated so they protect their own children?
In other words, the parents are not giving approval for their minor child to get vaccinated?
They're not of age. They're not
Yeah,
of age.
correct. And so that's a good question, and you know, that's just part of parental responsibility that we can't avoid and we shouldn't avoid. Parents, you know, guide minor children. Now, I've seen a lot of instances, though, that, you know, particularly the teenagers, they think for themselves, they study these issues themselves, and they'll go home and they'll tell their parents, I'm getting a vaccine, I want to get a vaccine. And most parents, under those circumstances, allows the teenager to go ahead and get a vaccine. But we do, with the Department of Health and with our schools, have to have permission for the vaccine. Am I correct?
That is the health department's policy to get permission if we provide the vaccine. It's not required by state law, but that's the decision we have to take.
Okay, and let me elaborate on that once the FDA, and I expect actually that to happen within the next 30 days, that the FDA gives final approval for the vaccines, where they've done all of their, you know, crossing the T's and checking everything and all the research, then there will be some states that may mandate the vaccine in the schools. I doubt that we will do that in Arkansas. That would take a decision of the legislature to do that. But I expect that hopefully parents will be more amenable to broad vaccination whenever we get that FDA approval if they have reservations now. Yes, ma'am.
If the child has had a mild case of COVID and has antibodies, are we still recommending the vaccine?
If they've already had COVID, mild case of the antibodies,
Has a mild case of COVID and has present antibodies.
yes, I'm going to let Dr. Dillahay answer, and I'm glad you got a microphone. Go ahead and stand up, Dr. Dillahay.
So we do recommend that people get vaccinated of any age if they have had COVID-19. The evidence appears to show that people who have natural disease do not develop the neutralizing antibodies to the level that people who have had the vaccines. And with the Delta variant, you may need that extra cushion if your first variant was not the Delta variant.
I didn't know if in children they might have a better response to developing antibodies than adults.
I am not aware of any data that shows that at this point.
So go ahead and recommend.
Yes.
And they take 2 vaccines, you talked about.
So far, the authorization is for 12 and older, and it's the same doses. The younger ones, when they become authorized, it may be a different dose.
So what
Question. Yes.
if, I have a niece that's in the process of, she wants to become pregnant. So if you are pregnant or are wanting to become pregnant, what about that young lady?
So we recommend, or many physicians recommend that pregnant women get the vaccine. The CDC and the FDA say they may make that choice. There's not an official recommendation one way or the other. We follow the CDC recommendations, but the OB-GYNs that I'm aware of recommend it because women who are pregnant are at a higher risk for having pregnancy loss and poor birth outcomes.
Yes, we saw that.
Yes. And there is no effect on the vaccine that's known on fertility. So women who want to get pregnant, you know, may freely get vaccinated. There's not a problem.
Do we have the PSA, the public service announcement? Won't you, it might be a good time to tee that up. And this is a,
Are the infants born with antibodies?
So the antibodies can pass through the placenta,
if we
so they
can,
get some.
all right, let's, so this is, you've probably heard this, read the story, heard about it, this lady in Star City. Let's see if.
I was hesitant to get the COVID-19 vaccine because I was 30 weeks pregnant, and we were probably both skeptics of it.
We lived in a small rural towns, and we were very reclusive because of pregnancy and COVID-19 going around.
I started getting very, very sick.
We went from sinus problems to life support in 10 days, and it was all so fast.
We were both terrified. I needed to have an emergency C-section. Not only was I on life support, and I had a very slim chance of surviving, I also have scars to prove, you know, this illness doesn't discriminate. It affects everyone, and it can be deadly. I almost died from it.
I got vaccinated the day that my daughter was born because the doctor said that that would be the best thing that I could do for her health and mine.
My thoughts have definitely changed on the vaccine. I do believe getting vaccinated is the safest thing to do for your family. It's the safest thing to do for our family. The best decision for us is to get vaccinated.
Save lives. Get your vaccination. Learn more at healthy.arkansas.gov.
Grateful for that young lady being willing to tell her story. I think that says a lot. Anybody over here? Yes.
You're saying that 35% of the people in the state of Arkansas have been vaccinated. Is that adults, or is that, I've got another question to follow up.
That is
The population
the
at
entire
large?
population, 35% of the entire population has been
Okay.
fully vaccinated.
Okay, my question is, and I hope you and y'all realize this, that it's not a hesitancy. There's several reasons why. One of them, and probably, they haven't shot straight with us. CDC has not shot straight with us. Fauci has not shot straight with us. They've changed their stories multiple times. People don't trust the government. A lot of people don't trust the government of what they're going to do. They haven't given us what the risks are of this vaccine. And you got it, and they haven't, here's another of the dangers of the vaccine, but they've quashed any type of effective alternative treatments. They said, no, you don't do that. You don't do that. Hydroxychloroquine, ivermectin, they work. I know people that's used it, it's worked. If this was before the vaccine even came out, people were taking this. I don't understand, number one, I don't understand why they did that, but my question is, I will be shocked if most of these people that are unvaccinated will be vaccinated. I'll just tell you that right now. They don't trust it. They don't trust it. What are you gonna do if we get, let's say, 50% of the population of the state of Arkansas vaccinated? What are you gonna do?
Well, let me ask you what advice you'd give me,
Shoot straight with the people.
okay?
Tell them the fact, tell them the truth. You were talking about misinformation, but you do realize that there's been disinformation going out there from the federal government about this. You can't deny that. Fauci's changed his story a half a
Okay.
dozen times. CDC's done the same thing.
I hear you. You made the point, and I got it. But we still have a deadly disease that's killing people out there. And so the question is, what do you do about it? And the answer is, be honest with the people. I agree 100% with you. And, you know, and I've been in this for 18 months, and I've had news conferences. I'm daily, as you know. You got tired of seeing me out there. And we learn as we go along. There was so much we did not know early on. And we know a lot more today than we did then. And if you don't trust Dr. Fauci, and that's fine. He's been wrong, just like other people have been wrong on some things. But the FDA is a gold standard across the globe. Our pharmaceutical companies have prepared in record time a vaccine that the world wants and needs desperately, and that's the standard we have. And so I would encourage those that don't like what you hear from Washington, please go to your medical doctor, go to the clinic that you trust, go to the sources of people that you trust, and not the internet, but go to the sources of people that you trust, that you believe are medical experts, and listen to them. And that way you're bypassing the government if you're skeptical about it. And I'm open to suggestions. I know that skepticism is out there, and what you said, I think, is a concern to me, which is that you've got a level of resistance right now that it's going to be hard to overcome those that have already made up their mind that there's mind control in the vaccine. And so let me pass it around here. I got your point. All right. Anybody else? Yes.
These new cases for the last month, is this spike, is it coming from the rural community?
As
Or do
to
we know?
well, we know it started out first actually up in Baxter County, where we saw the first spike in cases and the Delta variant, and that was where it was close to Missouri, and so that Branson area and southern Missouri first had it, and it came this direction, and then it's just spread now. And we test. Not 100% of our cases get this kind of analysis, but we do enough that we know that the Delta variant is in really every part of the state. Dr. Did you have, go ahead and add if you wanted to.
So we are seeing widespread Delta variants, and every week we send a certain number of samples to get sequenced, and the majority of them that we get sequenced are coming back Delta variant. And that's up from, 0 several weeks ago. So
it's not coming from the rural community?
no, it's, but it will be in rural communities. This variant is so contagious that if there is a pocket of people who do not have immunity, it will find them. That is one of my concerns for Arkansas.
Are we monitoring the?
Where are the cases? I mean, it sounds like we're not.
Yes, we are monitoring it. So what we do is when we see an outbreak, we get samples, or certain cases, people in the hospital, we get samples. And we can tell where they are from. They're from counties all over the state. And if we haven't identified it in a county, that doesn't mean it's not there yet, because the sequencing takes time, so there's a lag between when we collect the sample and when we know what the sequence is. The Public Health Lab has recently purchased equipment so that we can monitor it closer to real time, and starting 2 weeks ago, we worked out an arrangement with the Public Health Lab in Minnesota to get a week's turnaround. So part of it is there's a gap between the time we collect the sample and when we get the result to know what the sequence is.
And I mean, we try to get all the information we possibly can as to where the cases are coming from. That's what I get every day, and we know geographically where all the cases are, and hospitalizations, deaths, we get that information, and I ask those questions, and most of the information I come back is there's not a county in Arkansas that doesn't have it, and that there's not a county in which there is not some risk of that spread. And that's why we'd say protect yourself and protect others, but now it is just get the vaccine. All right, yes, ma'am.
So my concern is the children under 12. Okay, how do we protect them when they're going back to school, and their families are coming in that are not vaccinated. From my understanding, correct me if I'm wrong, children are higher carriers of it without symptoms. So if they're bringing that into the schools, and my child becomes a carrier and brings it home to somebody, how do we protect our kids that are under 12
Well,
going back to school?
yeah, and it is something that we have to address. That's a very, very good question. And the answer is that we have to have a cocoon around them, as Dr. Romero referenced on one occasion, and I repeated, and which is that when that child from school comes home, 11 years old, hasn't been vaccinated, and it becomes a carrier, first of all, the teachers in school need to be vaccinated. And then secondly, those in the home need to be vaccinated. And that will protect those in the home, and that will minimize the chance of that 12 or 11 or 10-year-old being a carrier. And so, like you said, those symptoms are very, very light if they get it, but they're a carrier, and so that's where we just protect around. And so that, to me, is a solution, is the vaccinations. It could be that we have FDA approval for 12 and under if they do the testing. I think it'll be a very small number of that age group that actually gets the vaccination. I think even once it is authorized, but the answer is everybody around in that family needs to get that vaccination. Dr. Delahaye?
I would echo what you said, Governor. I think it's important to protect the children by vaccinating the people around them. And also to pay attention to their after-school activities, because school could be a fairly protective environment, but sometimes the after-school activities are not very protective, and parents need to give some thought about the after-school activities their children participate in.
So I love this email I got. This is an email after we started our community conversations, and this is, they said, I and my husband were very reluctant to getting vaccines for the COVID, but yesterday you made me see it in a different light when you said we as parents can be the children's cocoon, and that hit me sincerely. And so my husband and I went down to the nearest place, which was MediSave, and got our first dose of the vaccine. And so that resonated with that parent anyway. Yes, ma'am. Then we'll come here. Yes, ma'am.
I kind of want to know about, as far as like children go, what about if parents want to do a waiver for the vaccine?
There's no
for 12 and
requirement.
under. 7 out of 8 of my family has gotten the shot. I just came from Children's today, and I asked a lot of the resident doctors and stuff what they're seeing, and they are really terrified about this Delta variant. And the number one thing that they asked about was the masks, going back to mask. Would you be willing to do masks again?
In the schools or where? Everywhere?
Everywhere, because, I mean, you know, they can't speak for themselves, and these doctors are very nervous about this stuff, so.
So you're saying just, when you said waiver, you really,
Well,
you just
waiver
meant-
for the vaccine for 12 and under, if a parent wanted to get it.
Oh, I see.
And then also the mask mandate.
Okay, I'll address the mask mandate. You can address the waiver.
Okay.
Let me just start with the waiver.
Yeah, I'll take the other.
So by waiver, do you mean allowing them to get the vaccine even though they're too young?
Yep.
Yes. So we cannot do that under the emergency use authorization that the FDA has given us. So if it is fully licensed and gets to the point there's more leeway to use discretion along those lines, my hope is that the 5 and older will be eligible under the EUA in the near future, in the early fall perhaps. They have clinical trials currently going, and it's possible that they will have completed them. And if the FDA allows them, we'll have those vaccines available in the early fall.
And in terms of the mask mandate, everybody, and tonight's an illustration, has a prerogative, absolute right to make a decision to wear a mask, and we shouldn't be judgmental about that. We should understand that. I had a staff person came in today with a mask on, and they said, "I just got the flu, and I'm just trying to protect you and others." And now, from a legal standpoint, you know, a law was passed in the last session of the legislature that prohibited mask mandates in Arkansas. I think it goes into effect like July 28th in terms of governmental action. And so that prohibits that option in the schools or in the government imposing that. Did you have a follow-up?
So what would be the solution if parents are reluctant to get the vaccine for their children or for themselves, and then you've got people going into Walmart or somewhere else and they're not wanting to do these types of things to keep other people taken care of?
Yeah.
Well, I try to protect myself, but like going to like Children's Hospital and stuff, I see all these innocent children that can't speak for themselves, and parents who aren't wearing, aren't doing
It
anything.
all comes down, we can protect ourselves individually by getting a vaccine. We can get that, and so that allows you, even though others are not getting that, if you go into the store, if you go somewhere, you are protected because you get the vaccine. Now, and if somebody says, "I'm not going to get a vaccine shot," they can still wear a mask, but those are the options. It just comes down in our society at this point in our society and where we are in this pandemic of individual responsibility. One quick follow-up, and we got to get this gentleman.
Would you be willing to mandate the vaccine?
Mandate the vaccine? I'm prohibit.
If we're at the point of 35% and we look silly on we look silly. Oh, I'm sorry.
Yeah.
We look really silly on all the news and stuff and everything. So,
I got your question. I got
Okay.
your question. The question is, would I be willing to mandate taking the vaccine? And the answer is no now, because it's an emergency use authorization. And then we have a law that prohibits the state from imposing a vaccine requirement. And so my only option would be to call the legislature into session to reconsider that. We're not there. I can't predict what the future holds, but I'd rather rely upon individuals getting out there in communities, making the decisions. Let's do all we can to increase that vaccination rate. Yes, sir.
I would think that getting vaccinated against a deadly virus, against a deadly virus would be something everyone would do. But it seems the numbers show there's a discrepancy between the two parties of getting the vaccine, and it's almost become a partisan divide between the two parties. My question is, who do you or what do you believe is responsible for that, and why is that so?
Well, that's a point that a lot of the national media make, but you know, Arkansas is a red state, and we have over 1 million Arkansans that's vaccinated. I'm a Republican governor. I've been vaccinated. My wife has. My children has. And so, you know, I think that partisan divide is overstated. Good Republicans are getting vaccinated, and good Democrats are getting vaccinated. So every chance we get, we really need to minimize that divide and just say it's the right thing to do for our health. Now, you know, there is misinformation out there that's perpetuated, and, you know, and I've said that sometimes conservatives are so skeptical of government that creates the hesitancy. And so the only way you ever can overcome that kind of skepticism is by facts and truth, and to this gentleman's point, being honest every step of the way. And so we've got to do that. There's one other part of the question, I think. I missed. Oh. Well, you know, that's history, so to me, it's more about the future and what we can do to pull together as a country to get vaccinated, and that's what we're trying to do. All right, those are really good stuff. I appreciate the respectfulness and the questions and the comments as well. And by the way, Jordan Burgess, where are you? Jordan Burgess is here. So we were in Batesville, and they made a point that, no, we're in Batesville. We were in Cabot. And they made the point that, you know, in some of the clinics, people aren't online, they don't go to websites, so we need more printed material, and so the Department of Health did get some printed material. So if anybody is in that category, we'll put that out on the table, right, Jordan? Okay. What else?
Governor, they have vaccines set up next door back there if anyone wants them.
Well, I hope they'll take advantage of that. Yes, sir.
Do we have a percentage of teachers statewide that have been vaccinated?
All right. The answer is we have checked that. Do you have the latest data?
I do not know those numbers off the top of my head. That is being looked at, and if you want to, I'll give you my card and I can follow up with you.
The last statistic I heard on it, and it's a little bit outdated, but it was probably 50 to 60% of the teachers have been vaccinated. And I do believe that the schools are making a real effort. Some schools are actually giving an incentive, and so I think you'll see those numbers go up. But let me ask it in terms of our healthcare hospital. Yeah, so how are the healthcare workers doing in vaccination? Because that was a discouraging point to me at one point.
One of those young ladies on that, well, they're probably
Introduce yourself.
Hi, everybody. I'm Gary Paxson. I'm the CEO of White River Health System. I believe the question was, what's the vaccination rate among our
Healthcare
workers?
professionals.
So currently, our vaccination rate within White River Health System is 60%.
Well,
That's what makes it feel so high.
yeah, the 60% is good. It's getting up there. I know it takes some work to do that, so thank you.
Mm-hmm.
Do you have any other comment that you wanted to make while you got the microphone there?
Hi.
Hi. Who's this gentleman right beside you?
Sure. This is Dr. J.D. Allen. The governor made a very good point earlier about finding somebody that you respect to ask the question to. I can empirically stand here and tell you, if you talk to any physician on our medical staff, almost 100% of them have received this vaccine. They believe in it wholeheartedly. They've studied the science. They stand behind it. They've put it in their arm, and they believe in it 100%. So please, we implore you to reach out to those physicians, those providers, nurse practitioners that you trust in this community who stand behind this, because they're adamantly in support of it.
Thank you.
I got one quick point too, and Dr. Anderson might be able to chime in because he takes care of most of the COVID patients in our hospital. But we've got 20-something patients, right? 20-something patients that are in the hospital with COVID, none of whom have been vaccinated. We don't have anybody in the hospital as a result of a side effect of the vaccine. So you can draw your own conclusions.
That's an easy conclusion to draw. We had a question right here.
I would like to personally thank you for your leadership during this pandemic. You've really cleared the air on a lot of things. So, second, onto the question. What are you doing as NGH here to specifically target COVID spread in Arkansas? And is there any particular governors you've been working with? Because other states have been affected. lot worse, I'd say, than Arkansas has, or it is currently.
Well, first of all, the NGA is a good vehicle to share best practices. And I actually reviewed them again over the weekend, seeing what some other governors are doing, what works in other states. And every state is different. And like I said, I think that what's common among the low vaccination states are Delta, rural, there's other ingredients there. But what we're doing is, this is unique. I hope this becomes a best practice. I hope that these community conversations is something that can be effective. So we're going to keep doing that here in Arkansas. This week I'll be in Blytheville and Forest City, Mariana area, and then I'll be down in Texarkana. And so we're going to keep doing this as long as it's effective, because that's about the only straw I got right now to work with, and the other tool, I should say, to work with. And some of the other governors in Ohio, initially, their $1 million lottery bumped it up for a little while, and then that became ineffective, and they canceled that. And some of the Indian tribes have been very, very successful. I don't know all the ingredients, but in some of the states that have a large percent of Indian tribes, it's been very good. They're very effective getting it out. Federal government is much more engaged there. And, but, up in the Northeast, and there's a high level of education. There is a high level of a greater trust, and so they went out there and got the vaccination. The other thing I was thinking of, and I just wish it could have been different, but whenever the vaccine was scarce, I mean, we didn't have the supply, and we were having to manage it every week, and we first said only those 65 plus, those in the nursing homes get it, and then, medical workers get it. That was when the demand was the highest ever. And if we could have just had all of sufficient supply at that time, I think everybody, I should say everybody, would have had a large percent go and get it. Now that's a little bit of hindsight, but I do think, we couldn't do it because we don't have the density of population, but one of the things that have been successful in New York or Boston is those mass vaccination clinics in the ballparks where they could deal with a huge amount of population, and they got the supply in there early that they could do that. So I think those are some of the differences. Okay, over here again, is there a question? Nope. And some of the people outside, if you all want to come in and say anything, it's fine too. Don't be intimidated by these nice young people here. Yes, sir.
If the numbers of Arkansans continue to grow, cases or deaths or whatnot, what are going to be your protocols to see that number gets absolutely driven down? Because health is the most important. And also, with vaccines and this virus being pushed so much, what is being done to combat other sicknesses and illnesses that kill just as many or more people all around the world, like cancer, heart disease, drug overdoses?
Yep. That is a perfect question, because right now you see stories about the hospitals are crowded, and that the emergency room is having to send out a COVID patient somewhere else because of space limitations. Well, we have about 1/3 of the total number of hospitalizations now versus when we were at the peak. And so why is it so crowded now? And the answer is that for a year, people put off elective surgery, treatments they needed, annual checkups that they needed, and they're coming in, and the doctors, and y'all can correct me, but they're seeing poor health outcomes because of those delays, and so it might lead to hospitalizations now. And so the crowded hospitalizations is for all of the other reasons, not just COVID. But you know, early on, we said, well, put off elective surgeries, put off the other, and just concentrate on COVID. We're not going to do that again because there are the other health consequences that we have to do. And so we have to manage it. We have to manage it in partnership, and that's why I'll be having another call this week with my many hospital administrators and my winter health task force that drifted into the summer now, and we're resurrecting that because we need to coordinate our hospital coverage to make sure that we maximize our space and our staffing capability. The mental health consequences are serious. The drug addiction challenges have been serious. So we have to be able to concentrate on all of those at the same time we do COVID. Now, you ask, what are you going to do if they keep going up? You know, how do you prioritize that? And the answer is that we're going to work with our hospitals, and that's what I watch every day are the hospitalizations. Because, you know, it's one thing for somebody to get a case and they recover from it. We got better therapeutics, better treatment today. If we can keep them out of the hospital, that's a good thing. And the best way to keep them out of the hospital, the best way to keep those cases down is simply get a vaccination. So my answer is get vaccinated. Yes, sir.
I've got a question for the health professionals. If they have come down with COVID-19, are you giving hydroxychloroquine and ivermectin?
Does any doctor that has experience in treatment want to address this question? Dr. Anderson, the question is on hydroxychloroquine.
For anybody that has the COVID, are you giving hydroxychloroquine and ivermectin?
No, sir, we are not.
If the patient asks for it, will you give it? Or will he have to go somewhere else to get it?
I have not had a patient ask for it specifically that I've treated, so.
But would you?
No, I probably would not.
Thank you.
And do you want to elaborate on that? I don't want to put you on the spot, because the Department of Health can answer a little bit, but if you want to explain that a little bit more.
We follow CDC guidelines in our treatment, and so.
That's what I thought.
Yeah, and so in that, we've seen that the current treatments are working best.
Okay. And there's some of the current treatments are?
Remdesivir,
Yeah.
steroids, those are the big ones right now.
The remdesivir is what we've had the most success with, is my understanding and following it. Now, the hydroxychloroquine, that is something that is left between the physician and the patient, and it is not prohibited by the Department of Health or CDC guidelines. It is just left between the patient and the physician. Yes, sir.
You've done a lot for our state, for our community, and our county, and I thank you. What can our county do to reach out to these people in these rural areas? And I'll throw that question not only at you, but at our Gary Paxton. And I'll throw it out to, where's the county judge? Is he here? Anyway, what can we do as a county, as a community, to reach out to these people? And I'm with you. I'm not going to ask anybody to take the vaccine. They got to make that decision. But to get the facts and get the scientists out to the community, because there is a disconnect. Okay, so with that, I'll shut up.
So that's a question that many in your community need to answer. So let me invite some of the community leaders. What are your thoughts on how we can do more to increase the vaccine participation, acceptance, availability in the rural parts of Independence County. Anybody want to jump in on that? I'm going to jump first. You're a professional. All right, so do you have some ideas you wanted to say? Then I'll follow up.
Yes. So one of the things we've been looking at is some materials to do a rapid community assessment, that the leaders of a community can use this process. It takes about 3 weeks to do, and help identify some of the specific beliefs and characteristics in the community, and then work to develop a plan that the community or the county can work together. If someone's interested in that, I'll be happy to help connect with those materials in that process.
And so let me answer it in a different way. To me, it is about making it convenient and accessible. And you're right, there could be some that they're not going to take a vaccine regardless. But there's also, and I saw some surveys, probably 20 to 30% that are open to it. They've put it off. They've just delayed. They thought they were young. And so those are the ones that we can reach. And to me, you've got to make it as easy as possible. Where do people go? And the employers are such a key. We've got some great employers here, because if you're an employer, you're going to have people from all over Independence County working in your company. And so what are the employers doing? One, give them paid time off, and then that if they want to go get a vaccine, they can. Secondly, if they have questions, bring in a trusted advisor. Maybe it's a nurse professional, maybe it is a physician, somebody who can answer questions. If there's, whatever they are, provide that information, and then make it as accessible possible. And that all depends upon how many workers you have and things like that. But we've got, I know we've got some pharmacies that are here. If you raise your hand, if you're a pharmacy, introduce yourself.
Steve Bryant.
All right. And I bet you if a factory called you and said, can you come out and do a clinic for us, what would be your response?
When do you want to do it?
Yeah, exactly. So, there's a lot of keys there, and that helps cover the county where they are. I had this letter that this is another result, I think, of our COVID conversations, but the Greene County Health Unit, which is a part of the Department of Health, they are doing vaccinations at a concert. They are doing it at the farmer's market every Saturday. This is another area. But always think, where do people go? You've got some festivals coming up here in Independence County, don't you?
We just had downtown, and we had White River was out there. We're doing those things.
Okay. Well, obviously you are, because your numbers are good. I'm still troubled that it's not out in the community, and maybe there's some better answers out there. Yes.
I know there was already a game and fish license initiative in the state. These other states, you mentioned Governor DeWine in Ohio, and you also have Governor Justice in West Virginia and the other governors doing these incentives. Do you think there's any way that we can have some type of incentive other than the game and fish license to draw out the numbers to get the vaccination?
I'm absolutely, what'd you say? Yeah, well, I think there is a tax break for employers that give paid time off, so there is something at the federal level. But in terms of the incentives, I'm open to anything that works. Anything that works. Whether it's a college that wants to give some incentive and maybe the state can reimburse them. There's some steps we have to go through. But one of the challenges with incentives is that you've got here in Batesville 68% that's already got the vaccine, and they're going to say, well, where's our incentive? Because we did the right thing early on. And so that's why when we gave a state employee incentive, we went ahead and gave that bonus to everybody that's got a vaccine, even though it might have been a month ago. And so you've got that fairness aspect, but I'm open to any incentive that works and that's fair and that the legislature would support. You know, this is about close to the 1 hour, and so I don't like to go over that, but did I see a question back there, sir? No? Okay. Was there anything else? I don't want to cut anybody off. So I can't help but have a little bit of fun with this, perhaps. Maybe you won't think it's fun, but of course I get these messages from all over, and you know, there's this one from a particular group that said, "Urgent alert, our Arkansas governor are starting their propaganda campaign called vaccine hesitancy." And it goes through here, and what I got a kick out of that I hadn't noticed before is that it says the buzzwords for the vaccine that we should be using. In other words, these are that the anti-vaxxers want to use: bioweapon, genetic engineering, synthetic biology, genome therapy, and reprogramming. Let me just tell you, that has nothing to do without the vaccine. And we've got trusted advisors that will tell the truth. And so please, if there's ever any question, go to who you trust. Hopefully it'll be a medical professional, and just get their counsel. I can't answer all the questions, you know, and I just try to stimulate the conversation within the community and encourage everybody to do what I believe is really important for you, but also for our community and for our state. You all are terrific. Thank you for giving us this time in such a respectful way. I want to thank our state representatives that are here, Stu and Craig, for their leadership. Mayor, do you have any closing comment?
A healthy community is a productive community.
That's a good word. I think our judge is gone, but I do want to thank, and let's give a round of applause if we can, to all the medical professionals, the pharmacists that are here. I've had to deal with this for a year and a half, and let me just tell you, I didn't sign up to be governor to deal with COVID, but it fell in my lap anyway. And I know they didn't plan on this for a year and a half either, but we do what we need to do for our community. Thank you, and God bless you, and again, thanks for the great success here.